got to meet Lenny a minute ago, our patient, and these are his pictures. He's given us permission to show these. But this is his left knee, and what you can see here, this is a pretty good looking knee. I mean, it's not too far gone for us to help with, basically, but he's got some medial compartment joint space narrowing. He doesn't have severe spurring. You know, the bone tends to make these spurs and the ways to support itself once the cartilage breaks down, and he hasn't gotten to that point too much. So this is a really nice starting point. But more procedural details, like I said, we work from the same groin as the knee that we're working on. There's no incisions involved. We're basically introducing really thin plastic catheters, essentially, which are fancy straws, essentially, where they're, you know, in terms of diameter, probably like the diameter of a pencil lead. We have different shapes and angles and wires that we use to select the smaller vessels that supply the knee, and then we take these nice close-up pictures to find those capillary beds. Once we're in the spot, we basically just inject these microscopic particles, we call them beads, and we do that until we get rid of the capillary beds, and then we confirm that we've maintained flow around the knee. When we're done, we use a little closure device on the groin, send you to recovery, and you have to lay flat for 2 hours. That's maybe the biggest downside of the procedure. You gotta lay flat just to let that needle poke seal up on the artery. And then you get to go home. Things I'm used to hearing about that we touched on a little bit with Lenny. Your knee pain may be a little bit worse for 2 to 3 days after the procedure. Just a dull ache is what I'm used to hearing about. Typical anti-inflammatory meds help with that. Occasionally we will see a mild skin rash. It's not common, I would say, but it does happen. Some of these blood vessels of the knee have little branches that you can see here that go actually to the skin. So sometimes these injected beads will go to the skin and they'll like make a little purple mark on your skin. We say that's self-limited or goes away on its own. It usually takes a few days. You know, anytime we're working in the big artery of the groin, you will have a little bruising occasionally and sometimes some complications related to that. But Dr. Okuna out of Japan in 2017 published a great article. He used the WOMAC score, which is a nice recognized pain score that we use to kind of quantify someone's knee pain. And it's on a score out of 96. The higher the number, the worse the pain. He showed that in 9 out of 10 patients, he could cut their number in half 1 month after the procedure, and it would stay there for 2 years. Really nice results showing 2 years of durability of those results. I think there's indications that it will last longer than that, but we don't have proof of that yet. That being said, if we can get 2 years of significant benefit for relatively low cost to the patient and their pocketbook, it's exciting to me. So our experience here in Central Oregon has been very similar. We've been doing it here for about 2 years. Our results are in line with Dr. Okuna's results. Dr. Sid Padia at UCLA, he's doing a lot of exciting research, and I've been imitating some of his techniques and methods and seeing very similar results. We do this a lot every day, and we're very good at it.